I don't know if everyone's here, but I mean, we can get started. I just want to how I guess yesterday's session was very impactful for you all. We learned about, beyond communication, how we can, position ourselves, right, for real world influence. It's not just, I mean, I feel like you're putting a lot of time, effort, your money, your resources into doing this research, and it should not just end up in a shelf, or it should not just end up in, how do I call it, in your computer. Yesterday I was doing something because I told you guys that your research somehow helps you. I'm currently writing something in the US called EB1, that's like an employment-based visa for immigrants. And one of the things I had to do yesterday was I had to start putting my Google Scholar profile together. So I had to set up my Google profile. And you'll be surprised, I've not done this all this while. So I had to set up my Google Scholar profile, my ResearchGate profile, and all my research that's in the internet just went into there, right? I don't have so many research paper, but at least the one I did in my undergrad, the two papers that I published it came on that Google Scholar. The one I did in my job came on that Google Scholar. So you have an assignment. After this call today, I want you to go online, set up a Google Scholar profile and a ResearchGate profile for yourself. For yourself. Everybody must do that, set it, even if you don't have a research paper right now, set it up for yourself because it's very important. And this is what I'm going to submit when I'm doing my visa application, my employment-based visa application. They will ask you for the link for this. That is your assignment, the first step, setting up your accounts, like a social media account, but for research. So yeah, thank you. I think we can get started. Thank you so much, Mrs. Ano, for joining us today. I'm really excited to have you on board, and thank you for the time you've given us to learn. So I'm just gonna quickly
Thank you.
read up Mrs. Ano's profile. She's going to take us on the topic strengthening your research methodology. And Ms. Ano is a pharmacist with an MSc in health informatics and experience, and her experience spans across hospital and community health care, where she has delivered patient-centered care and gained exposure to healthcare delivery in resource-limited settings. As a healthcare administrator, Anoluwa combines clinical experience with digital tools to improve patient care, ensure accurate and accessible medication data, support clinical decisions, and streamline workflow. She also engages in health research focused on pharmaceutical services and healthcare systems with the goal to expand access to quality care and improve global health outcomes. So yeah, can we just give her like a virtual clap? To welcome her and thank her for being here. But I feel like before Miss Arnold jumps into today's session, I'm just curious. Maybe she can just tell us briefly why she went to do a master's. It might be a weird question, but I've always known Arnold to, be very, very passionate about clinical care, clinical pharmacy, and healthcare delivery, right, in the hospital setting. So I know, can you like just tell us briefly, like maybe just in 5 minutes before you begin your session?
Hello, everyone. Thank you, Izine, for the warm introduction and welcome. It's a pleasure to be here and being given this opportunity to share my knowledge with undergraduate researchers. So I decided to do a master's in health informatics. As you said, well, I'm knowledgeable in clinical practice and also in patient care. However, during my practice in Nigeria, I noticed that there are some pitfalls that technology can help improve, especially in my field in pharmaceutical services. Yes, can you hear me? Okay, so especially my field, pharmaceutical services, and because a lot of us don't have that knowledge in Nigeria at the time in terms of leveraging technology to improve health services, to improve healthcare in whatever way, for example, in pharmacy, medication management, and also teleconsultation. So those were part of the things that spurred my interest in health informatics and to have a master's degree in health informatics so that I'll be able to apply it in pharmaceutical services.
Wow, that's a very interesting transition. I really love it. You know, understanding a gap and finding a way to fill the gap. And that's what research is about, right? You find a question, why is things like this? Why can't we have? So one of the things that I feel like is very, very important that we kill a lot in Africa is that we are not bold enough to ask questions. And research is what, makes us curious. It makes us think about why is it that in this hospital we are always like the patients are always queuing up? Why is it that things are like that? And that's what makes you researcher. All the research topic everybody has here is a question. It began with a question, and don't lose that curiosity. So yeah, over to you, Miss Arno. Thank you so much for joining. I mean, you can share your slide and we can begin the presentation.
Thank you very much.
You can present now.
Okay. So today we are exploring the topic strengthening your research methodology. And sorry.
We can see your screen. Is there an issue?
Okay. So today we are exploring the topic strengthening your research methodology. And I would like us to know that during this section, we'll be focusing on choosing the right design, understanding ethics, sampling, and aligning your methods to your research questions. Because I'll try as much as possible to have an interactive section, and I would like your response in the chat. Can anyone share with us what is research methodology? You can just type it in the chat. That's fine.
Is there anybody who wants to help us with that, please? Or you can just come on mute, off mute, and just answer. I know your slide is no longer on the screen. Okay. All right. Okay, Aminu, please go ahead. Thank you.
Research methodology is simply the systematic process of finding answers to a specific problem.
Okay. Thank you, Mohammed. Is there any other person that would like to share with us?
Okay, Alisa, do you want to come off mute and say what you have to say? Okay, so we have to Israel and Anita.
Okay, Alisa, thank you for the opportunity to speak. To my understanding, research methodology explains the flow, like the layout of the activities that you're going to do in your research. So you also include the type of the study design that you're going to do. Either you're going to do the snowballing or any other type. So you have to explain it in the section of methodology. Thank you.
Thank you so much for your answers and response. Thank you, Mohammed and Anita. So research methodology can be described as the overall plan and strategy in which you will carry out your research. So your research methodology describes the approach you are going to use in achieving your aims and objectives, how you are going to collect your data, how you are going to interpret your data, and how you are going to communicate this. So research methodologies talk about the action. What exactly are you doing? What you are doing, how you are doing it, and why you are doing what you are doing for that particular research topic or for that particular research question. So, and then the strength of your research methodology determines how credible, how reliable, and how valid your research is. Because if you choose an appropriate methodology for your research topic to achieve your aim and objective to get your results, that determines how reproducible and how valid your research process is. So, and your research methodology has to be clear and be able to serve as templates, like for other researchers that may want to copy your guideline or like want to do something similar to your study should be able to follow these templates and be able to reproduce it. So majorly, there are three common types of research methodology. We have the quantitative research, we have the qualitative research, and we have the mixed method approach. So the type of your research question or what you aim to achieve, your objectives, determines the type of methodology you will settle for. For quantitative research methodology focuses on measuring and analyzing variables numerically. So there are numbers. You can quantify this. You can measure what you are studying. There are numbers. And also the design method for quantitative research could be descriptive, could be correlational, could be experimental, and could be quasi-experimental. For example, a descriptive research design is, for example, you want to measure the prevalence of prostate cancer among patients attending urology clinic. So in this particular experiment, you are describing what is already present. It's like you want to do a study and give a report of what is already present in the clinic, in the particular clinic. So maybe you want to measure the prevalence of patients that have prostate cancer in urology clinic. So you are going to be considering the male patients, and also what proportion of these patients have prostate cancer that are attending a particular clinic as prostate cancer. For correlational design, it has to do with two variables that are side by side. Like if there is an alteration in this, if there is a change in this particular variable, will it affect the other? For example, if you want to measure the impact of exercise, increased exercise on improved health, or on patients' blood pressure, the impact of exercise on weight, on obesity and comorbidities. That is a form of correlational design. And also, once it comes to experimental design method, experimental design is of quantitative research is the variable, the researcher can control the variable. You can manipulate the variable. For example, in controlled experiments, maybe in lab or also maybe in health care setting, you can decide to evaluate the impact of malaria drug in patients that are below 6 years, and also the impact of a previous malaria drug on already established malaria drug in patients that are also below 6 years. Like a form of controlled experiment, you want to see if maybe if you alter this, there's going to be a change. Which kind of change will you get? So in quantitative research, the methods for collecting data in quantitative research would be surveys, where you use structured response. You could say Likert scale. On what scale? On the scale of 1 to 5, how often do you exercise? Or how often do you eat? And also questionnaires, and also experiments. For example, in labs, where you have with reagents, or maybe in a clinical setting where you have patients controlled group, and also patients that are not being tested with the medication. And the data is provided in form of numbers. The purpose of quantitative research is to quantify results and also establish the relationship between variables. So it answers the question of what, where, when. So once you have any question on what is the impact of this particular medicine on pregnant women, those are quantitative studies example. And the analysis of quantitative study could be statistical. You calculate frequencies and mean. However, for qualitative research, sorry about this. For qualitative research is not that common. It's in health care, but there are more interest and focus in qualitative research at the moment, common in social sciences. Please, can I get a reaction? Are you getting what I'm describing, what I'm teaching, please?
Yes, getting it, ma.
Yeah.
Okay, thank you very much.
We are getting, madam. Hello,
Okay, I can hear you. Thank you.
but I have a question.
Okay.
Yeah, I didn't get you on gas experiment. Can you come again on that, please, if it is possible?
Okay. So for experimental design, it means the researcher is in control of the variables. You can manipulate it to what you want. For example, if you want to test the efficacy of a particular medication, maybe a new medication, an improved medication, you want to test it on malaria or malaria parasites, and you have an established medication which has been used for malaria parasites. So you could do some analysis. Okay, this is a controlled, or maybe this is a placebo without the medication, and your experiment has the medication provided. So you test this on maybe the parasite or patients, and use it to get the results. Do you get that now?
Yes, I'm getting.
We can get
Yes, we are getting it.
we can get that, but come again on quasi experiment.
Sorry about that. So for quasi-experiments means you want to compare in various settings, but you are unable to manipulate the settings. For example, maybe you want to evaluate the impact of various teaching styles on patients, maybe on students, a particular set of students. You want to evaluate the impact of various teaching styles. So it's not possible for you to do a particular teaching today and do another one tomorrow and evaluate your results. Quasi-experiment, you can decide to select different classes that are already applying various teaching methods. So you compare the impact of the teaching method on the students in class A to that in class B. Are you okay with that?
Yes, we are okay,
Yeah.
madam.
Okay. So for qualitative method.
Can I ask a question?
Okay.
Somewhere that quasi-experimental is different to experimental research in such way that in quasi-experimental there is no randomization of assignment or random assignment of random assignment of intervention to the variables. Would that be true?
Get that. Can you come again?
I was saying I have read in some books that quasi-experimental is different to experimental in such way that in quasi-experimental there is no random assignment of intervention to the variables.
That quasi-experiment is different from experimental design. Quasi-experimental design is different from experimental design. Could you keep the questions to the end of the class so that we'll be able to cover up some things, please?
Yeah, I think so.
Yeah. Yeah. So for the qualitative research methodology, you want to explore ideas, opinion, and experience of people in details. So these ideas that you'll be generating qualitative research will be new. They are not something known already. They are not available. So you are just going to generate the ideas. So example of design for qualitative research is phenomenology, case study, ethnography. In phenomenology, you want to study a phenomena about people's experiences, their life, about their behavior. Also in case study, you also explore a particular condition over a while, and ethnography has to do with. So the methods applied in qualitative methodology include interviews. You talk to your participants, ask them some set of open-ended questions to understand their belief, to understand their experience about that particular study you are doing. You want to understand their perception about a thing. And then you could also do focus group. For interview, it's going to be one-on-one with participants, just like one participant per time. The researcher will interview the participants. But for focus group, you could have a group of participants together. You interview them at the same time. But the limitation about focus group interview is that a researcher has to be very advanced in conducting interviews before they can do focus group. But for a start, one-on-one interview is recommended. Also, the type of data in qualitative design are non-numerical, they're in words, because you are trying to know the life experiences, their perception, their view about a particular treatment, about a particular situation, about what they've been through. So you want to generate ideas from this. So it's in form of words. It could also be in form of images. So it's the researcher that is going to analyze the words provided, or maybe if it's image, is based on the researcher's discretion. And also the purpose of this is to understand the why and how behind the particular phenomenon. So thematic analysis is used in analyzing qualitative data. You listen to the recordings of the research and you will generate themes like things of similar pattern. You group them together in qualitative research. For mixed method is a combination of the two. Mixed methodology is used to address complex research questions. You combine both qualitative and quantitative in the research, and it actually takes a while. It takes a longer period of time, and it could also be beneficial when the researchers are more than one working together because it's complex. So these are some of the example of research topics for quantitative research, qualitative research, mixed method, because your topic and your aim determines what the type of methodology you will use. For example, quantitative research, you want to measure the prevalence of prostate cancer among male patients attending a urology clinic. In that particular situation, what you work with, you can work with the patient folder. Maybe if you have access to the digital record, you can identify from the number of patients attending the clinic, those that have prostate cancer or not, you document. Or if it's also by survey, you could administer questionnaire to the patient and to get numerical data. Also, the impact of exercise of patients living with obesity and hypertension. So it means you are measuring something, how exercise is affecting people living with obesity and hypertension. Is it positive? Is it negative? Is it helpful or not? Can you see any reduction in weight? Can you see any reduction in blood pressure? So all this will be useful in generating your answers, your conclusions. Also, another example of quantitative research is comparative effectiveness of a new anti-malaria drug and placebo in reducing malaria incidence. Like I explained earlier that for the experimental design, there is a control and there's control and there's a major thing that you are testing. So maybe there's a new anti-malaria drug. You want to test how effective it is in treating malaria, and also you test it against a placebo. What are the actions? What are the results that you could get? Also, another example, evaluating the effectiveness of training intervention in increasing patients' use of mobile health data. So those are types of, you are measuring something because they are quantifiable. You can measure it, you get numbers. So typical titles of quantitative research, we have prevalence, effect, effectiveness, impact, the relationship between this and that. So for qualitative research, topics such as the perception of undergraduate students in UN, on mental health interventions on academic performance. In such instance, the researcher wants to know what undergraduate students think about mental health intervention. So it depends on the research questions the researcher wants to ask. What type of mental health intervention? What is their view? Is mental health intervention, is it good? Do they think it's good to help their academic performance? So from that result, the researcher may be able to use, okay, patient students, undergraduate students, mental health interventions will be helpful for their academic performance. So that's a form of like hypothesis. That's a form of generation of results. That, okay, from this and this, the undergraduate students in this particular university think mental health intervention will be helpful for their academic performance. So there could be recommendation of such intervention in the school. Also, assessing the readiness of health providers for AI in health services. You want to explore if healthcare providers are ready to use artificial intelligence in health services. Are they ready? Are they willing? So, because you don't really know the answers to this yet, you don't know their view about it. So this kind of research method, qualitative research method, is useful in introducing new things or introducing a new method, a new approach in the way the particular people have been doing things. So from the data you generate, you'll be able to know, oh, we can implement this kind of policy or not, we can make this kind of suggestion, because based on interviews that has been carried out, care providers are ready. They know how to use it or they do not know how to use it. Also, exploring the health behaviors in the rural community on maternal health. So this is like a form of observation studies, and it's going to like take a while to do that. So for qualitative research, you avoid terms like effect, impact, or relationship, because this means that you are measuring something. Because it is not, you are not measuring anything. You just want to understand what is happening. You want to assess the whole situation. So these are also other types of research questions. What is the prevalence of hypertension among adults in Lagos? So the survey will involve measuring their BP, about their BP, and also you could differentiate male and female by age, or maybe social status. So that is a form of quantitative research. And also, how do patients perceive the quality of care in a rural clinic? You are trying to know their view about it. Do they like it? What do they want to be improved? That is a form of qualitative research, because it answers the question how. Are we good to go?
Yes, ma'am.
Go ahead, yes, we can hear you. Can.
Okay. So sampling is the process of selecting a part of a population to represent a larger population. When you are doing your project, there will be a large population to pick from, and you can't actually deal with all the population. So in research methodology, sampling is a form of method to help to take a particular part of the population to represent the whole population. So that kind of population, you'll be able to work with them easily. So population is a set of people, events, or items in which you are interested in studying. So for example, let us say a researcher is interested in studying on all pharmacists in Nigeria. So the sampling will involve, okay, let's pick a smaller group, 100 pharmacists from different states in Nigeria. So it helps to determine, is an important factor to determine how accurate and reliable and valid your research is, because it's something you can work with. It's not that you are formulating results, not you are formulating data. You are working within a time frame, and you are able to select a representation of the whole population. So the part of the benefit is that it saves time and resources. It makes data collection visible and allow researchers to generate findings. So, sampling method. Types of sampling methods. We have the probability sampling, which involves the simple random, the systemic sampling, the stratified sampling, and cluster sampling. Probability sampling is majorly used in quantitative research, while the non-probability sampling is majorly used in qualitative research, and it's some example of it are convenient, purposive sampling, snowball, and quota sampling. So this is just a table to illustrate how each sampling method works. So let's say, for example, sorry, I'm using a lot of pharmacy scenario. I know it's a global health research thing, and it's sorry because I'm a pharmacist, so I'm more in tune to using a lot of pharmacists than something related to pharmacy. I'm sorry if you think it's just limited to pharmacy, which what I've explained is also applicable to any global health research you can do. I'm just trying to provide easy examples that we can relate with. So for the sampling side, the probability sampling, everyone has a chance of being selected. You can select everyone in the population. So for random sampling, simple random sampling, the individuals are selected randomly. Let's say, for example, the researcher wants to work on pharmacist and electronic prescription system. So you have access to the, in pharmacy, we have a registry for registered pharmacists yearly. So you could request for access to the pharmacist registry, and then you pick randomly 100 pharmacists from the whole registry. For systematic sampling method, you select every nth person. Let's say every 10th person on the list, on the whole list. That's a systematic sampling method. For stratified sampling, you divide into groups and sample from each. Okay, because in Nigeria, for example, we have the north, we have the south, we have the east. So you can group this into, okay, pharmacists in the north, pharmacists in the south, pharmacists in the east and the west. Then from that grouping, you pick at random the people you want to participate in the survey. Also on the cluster sampling, you randomly pick from each entire group and cluster. So select a format from 5 random choosing states. So for non-probability sampling, noted earlier that it is majorly used in qualitative sampling and qualitative methodology. So not everyone has an equal chance of being selected, because qualitative, you are majorly working with a large group of people. So not everyone has an equal chance of being selected. So in such case, for your qualitative research method, you can either employ convenient sampling, in which you pick whoever is easiest to you, whoever is accessible to you. For example, you can decide to interview pharmacists that you can easily reach, maybe pharmacists that are within your university area, within your community area, to participate in the research, or pharmacists that you have access to already. But one challenge of convenience sample is that it could lead to bias in your results because of familiarity. Also, purposive sampling, you pick people that meet certain criteria that you want. You can try to work with, okay, I want to work with pharmacies that are already using electronic prescription system in their facility or that have used it. I don't want to work with pharmacists that have not used it, because my research topic is centered on pharmacists and electronic prescription system. So you will work with pharmacists that are already using the electronic prescription system, because they will be the one to be able to give you the kind of data you need. And there's another form, the snowball sampling. So participants refer others. You use this method when you don't really have access to the participants. You don't really have access to the quality of participants you think will give you the results you want. So you can say that, oh, anybody that you interview, can you refer someone in your particular field that have similar experiences? So that's a form of snowball sampling. Like, the participants you select will be the one to refer other participants to you. And then for the quota sampling, you match certain characteristics, like, okay, I'm picking 50 female pharmacists, I'm picking 50 male pharmacists. So another significant thing in research methodology is the size of your sample size. It determines the strength of your methodology, because if you use too little sample size, it could affect the quality of your data, how valid it is to that particular research you are doing. And if you use too large number of participants, it could affect your research. So there are several formulas to determine sample size based on population type and research method. So I'll apply a link here. You can check the link to see the different type of sample size methods that are available based on the type of research you want to do and the population type. But for qualitative methods, typically it's about, for interviews, one-on-one interviews, is about 10 to 30 participants for the sample size, because it's a representation of a particular group. And then for the focus group, it could be 6 to 12 person per group, and observation 12 to 20 sections. So the attached link, and I also attached some link in the references for further studies. You'll be able to understand sample size in research. So an important part of research methodology is the ethics, and it is very important. Can anyone tell me what they understand by ethics, particularly in healthcare, and also why is it important? Why is ethics important? I'm waiting.
Can you hear me all?
Yeah, I can
Yes,
hear you.
I
Go
can.
ahead. Go ahead.
My own understanding, ethics are just some principles that guides a way you follow the rules and regulation for our research. And they are very important because it guides the researcher to avoid everything that comes out of the research which is not related. For instance, the consent form we usually give to the participants are part of the ethics. This is the brief I can say. Thank you.
Thank you very much. What's your name, please?
Anas Al-Kashi.
Okay, thank you so much, Anas. I can see Anita is raising her hand.
Hello.
Hi.
Yes, my name is Anita from Ghana. So
Okay.
ethics in research is really important because it helps protect the participants in the research. So for example, if you're doing a research, you have to properly inform the participants so that they can give their informed consent about every information they have to know about the research. You're supposed to provide it to them so that they can make informed decisions and choices. Thank you. Thank you.
Awesome. Thank you, Anita. You guys are already fireful. Yes, you both said important things and very, very relevant things. So ethics is very significant in healthcare research because we are working with life, and also we have to, the healthcare profession is a noble profession. So we have the responsibility to be honest, to respect, to protect people that we are working with or we are working for. So ethics is a set of guidelines that is provided to ensure that we conduct research in a very appropriate way and is carried out properly, and to ensure that the pursuit of knowledge is not at the expense of the well-being and the dignity of the participant. It's not that, okay, because I want to get my data, I don't know. So that's why ethics is in place. They are a set of conducts, they are a set of guidelines to monitor a researcher, to guide a researcher while carrying out their studies, to ensure that they are providing useful resources for the populace, and then they are not in any way harming the participants. So ethics determine the validity, credibility, and reproducibility of our research. And ethics also increases trust and upholds scientific integrity. So for ethics, because we are from several institutions and we are going to be exploring several scenarios, so it depends. And I know that undergraduate researchers, we have to work with their supervisor. So your supervisor is in best position to really guide you on what and what you do in your ethics. So there are institutional ethics, that is, maybe you are going to work with an hospital or with a particular set of community. So there could be a form of institution that is guiding the ethics regarding research in that particular center. So once you are preparing for your research, before you even start, you are going to apply for ethics approval. Also, it could be organizational. Maybe you are working in an healthcare sector also, so you are going to apply for an ethics approval. And also, it also determines depends on the departmental requirement, your particular course of study, and then your particular school. Do they want you to apply for ethics internally, while you also apply for ethics with the organization or with the community that you are going to work on? So these are part of the things you are going to find out in your research before you even commence. So what are required of you to ensure that your research is credible, to ensure that your research is valid and is not bypassing any boundary. So for the clinical practice and clinical research, ethics is put in place to ensure patient safety and rights. So to prevent misrepresentation of patient data, to ensure that you obtain the consent of your patient, is very, very important to be transparent doing your research. Let your patients know what you are doing, what you want to do, what you want to achieve. There is no need to be deceptive. So give them the right to choose to be part of the survey, to be part of the experiment. Give them the right to know what you are doing. And also, it's best to have their consent signed, especially if it's a quantitative study. It's best to have their consent in a written format and signed for future references. So respect their autonomy. Autonomy is the right of patients to be part of a study or do not want to be part of a study. For example, in qualitative research, a participant may say, I want to participate in this study. But while you are conducting the interview, the participant will say, I don't want to be part of this study anymore. I don't want to participate. I don't want my details to be included in your study, because those are part of the challenges of qualitative study. So you have to respect that as a researcher. You don't have to put their information there if they don't want to. And then beneficence. Is this research beneficent to the participants? Let them know if it's beneficent to them. Hope is not that the research will hurt the participants in any way. For example, maybe you want to test about a particular medication or a particular intervention and you need a control group. If the control group has the same disease as your main group, you are not supposed to withhold treatment from them. That is a bad conduct. So it's best in such a situation to use maybe participants that do not have the disease and the participants that have the disease. Or maybe, okay, they're already using this particular drug. You just want to test a new drug on a particular group. But let them know this drug is new. If it's possible that it's going to have side effects, let them know. Also, for qualitative study, even in quantitative study, ensure that patients' confidentiality is maintained. Ensure that they are anonymized. That's the best way in doing qualitative research. Do not publish their names if they don't want it to be published. Do not include maybe anything that is related to their location if they don't want it to be so. So for laboratory research, other things about ethics requires the basic requirements for good research: hypotheses, good methods, good statistics, sample size. I mentioned earlier, not using too large sample size or too little sample size, proper data collection, put your heart into it very well, proper data collection, there's no need to manipulate any data, adequate result analysis, and also plagiarism, avoid plagiarism. Those are ethics in research. Avoid plagiarism, don't write word for word. If you get any information anywhere, reference properly. Also, no fake data. I've mentioned that there are no manipulation of data. So these are the requirements of ethics: transparent, be truthful, be honest about what you are doing, every action you are taking. The consent, especially for qualitative research, informed consent. Tell them what you are doing. Let them know exactly what you are doing, what you want to do. In fact, once you tell them exactly what you want to do, they will be able to provide you with quality data. They will be able to provide you with quality information because they really understand what you are doing. And also let the consent be written, because we say something that if it's not written, it's not done. So you don't want to be explaining it. So let it be documented, let it be signed. I was unable to add a sample of consent, part one consent letter to this presentation. Sorry about that. Also, confidentiality and anonymity. If they don't want their information to be out, do not publish it. And once you are maintaining that this particular study I'm doing, patients' information will not be publicized. So it's going to be across all patients. You can use identifiers like maybe in quotes to represent patients. Maybe it requires that you put in their names or put in the time, maybe female. You can just write F1, F2, F3, or P1, P2, P3. So you are the one that have the information, you know what you're analyzing. So that's how you communicate your results. Don't put people's details if they don't want it to be clear. And anonymity, an example of ways in qualitative research, because in qualitative research, the reason why I'm emphasizing on qualitative research is because you have to record the interviews for you to generate your data. So ensure confidentiality and anonymity. Let it just be only with you as the researcher, not that you are going to share the resources, the recordings, or the videos. No. In fact, in some cases in qualitative study, they utter the voice of the participants so that they are not easily identified. So also minimize risk in research and also ensure data integrity. Ensure your data is complete, ensure no manipulation, ensure that there is no bias. So these are part of the things that strengthens your research methodology. These are part of the things that make your research methodology reproducible and make your research overall credible and also reliable. So I think I'm at the end of the presentation. Thank you so much. These are some of the references I have. Okay.
Thank you so much, Ms. Ano. Thank you for today's session. Do we have questions? Maybe we can take questions now.
Yes, ma, I have a question.
Please, if you have a question, just raise your hand so that we can call on you. Yeah. Over to you. Go ahead. Okay, brother.
My name is Brenda Odera from Malawi. I'm doing biomedical science. You said something on the mixed method, and you said that it's just two blood. So does it mean that it's only suitable to those doing masters and PhD?
What method?
You said something on mixed method. You said it's two blood.
Okay.
Yeah, so does it mean that it's only suitable to those doing masters and PhD?
Yes, it's advisable at that level, or if you have a very long time for your research, because it encompasses a lot, because you have to do quantitative study and you have to do qualitative study. but it depends on the type of research you are doing. If it's something that you can achieve within limited time, that's fine. You can go ahead if you want to do mixed method for your research.
Okay, ma. Thank you so much.
But first consult, I think you have supervisors too. So I think once you put your research through to your supervisor, they will also be able to advise you properly on the best method to use. So if you are considering mixed method, your supervisor may say, oh, the time frame may not be able to. Maybe you can start on on the quantitative aspect first, and then you can progress with the qualitative aspect later.
Yeah, maybe just to also add, I feel like don't restrict yourself. If you feel you're up for it, go for it. I remember my own undergrad research was a mixed method. I did both qualitative and quantitative, research. It was not easy. It was very stressful, but that was what I wanted. So if it's what you want, it's what you desire, please go ahead. But have your supervisor guide you on the process. Amino, please, over to you. Your question.
All right, thank you very much, Ma. I have two questions here with me. The first one is you made mention of the mixed method being the mixture of the qualitative and quantitative. So I want to know, do we also carry out the measurements, that's the numerical measurements in the mixed method? So that's one. And then the second question here is, for instance, we used formula calculating our sample size, and let's assume we approach at 180 as our sample size. So I am aware that it's a bad conduct to reduce the sample size. So can we like approximate it to like 200? Like not increasing it too much, like just to 200. Is it appropriate to use estimated numbers as sample size? Thank you.
Okay, thank you for your question. So for the mixed method, you do both the quantitative and the qualitative. So it depends. Sometimes it depends on your research question and what you want to evaluate. Sometimes you could start with qualitative and follow up with quantitative, or you could start with quantitative and follow up with the qualitative. So it requires the two methods. So there will be numerical data, and there will also be maybe interviews or maybe focus group study. So it's the combination of the two. Is that okay?
Thank you. Yeah. Thank you very much, ma.
Okay. So for your second question, can you remind me? It's on.
Yeah, it's the estimation of the sample size. You said not increasing it too high and not reducing it. So I want to know, like, if you approach at a certain number, let's say 180 as an example. So is it appropriate to approximate it to 200, like as your sample size, that's increasing it a little bit?
Okay. There are formulas for calculating sample size, and I think it's best to stick with what the results you have, like, because those will be part of your record. You are going to provide the information, and once there is a standard, I don't think it is appropriate for you to alter it to 200. Like, you got 180 from your calculation and you decide to increase it to 200. I don't think it's appropriate, except you are trying to control, maybe you didn't get response from a particular set of individuals. Okay, that will be fine. But in qualitative study, your sample size is dependent on when you stop getting new information from the participants. In qualitative study, if you are interviewing people, maybe, okay, you decide to interview 30 participants, and once you get to the 20th participant, you notice that they keep saying the same thing. There's no new idea, there's no new theme. It's appropriate for you at that particular moment to stop the research and work with the reports of the interviews you have already, because you've not gotten to 30th, but there's no new ideas being generated. We call it data saturation. Like, you've already gotten to saturated and saturation points, no new idea, no new teams from the participant being interviewed. So in qualitative study, it's okay to stop before you get to the actual number.
Okay, thank you. Okay.
Yeah.
Yeah. Is that okay? Who asked that question? Was he Ahmed? Oh, okay. So let's quickly, we have a couple of questions. So maybe we just take all the questions and then Anu will answer. Anas, Vincent and Anas, go ahead. Anas, are you there? Do you want to come off mute?
Okay, can you hear me all? Okay, I am Anas Al-Kasim, and the graduate student from Bayero University, Kano State, Nigeria. First, I would like to appreciate your effort, Ma. The presentation is going to be useful to us. My question is based on autonomy of the participants. I mean, your research participants are school students, in which some are 18 years or above that, and some are not up to 18 years. And maybe after you have been cleared by, let's say, Ministry of Health or the school management, and you give consent form to those that are up to 18 years. So my question is, those that are not up to 18 years, are you going to give them a consent form to give it to their teachers or parents to fill it for them, or what? Thank you, Ma.
Okay, that's a very important question, and I think it's appropriate because they are still under care. So they are going to give it to their parents. Their parents will be with them to be able to consent to participate in the study. And you have to document all this in your research, in your methodology area. So what and what you did. Okay, the 18 years gave consent by themselves willingly, and then okay, maybe those that were below 18, they had to you had to introduce the awareness of their parents or the teachers to the study, and then they approved. But the children have to sign. That's to be in their name.
Okay, thank you.
That's it.
This is actually very important. Yeah. Sorry, Anu. We have a lot of questions. So this is actually very important because, I don't know if you guys know about the thalidomide scenario, right? Children were given drugs and then it caused them defect, right? You don't want to go and do a research that will put you in trouble, right? And that's why ethics is very important. You must take consent. You must take informed consent. Even when I was working in public health, even if we want to interview somebody, like interview them to talk, right? Somebody in Ministry of Health or working in the government, we have to sign. They have to sign that they're giving us the consent to do this thing. In the US, it's actually very regulated. You can't do anything without signing. And that's why healthcare is very delicate because you're dealing with human lives. A lot of questions, so we might not be able to take everything, but Vincent, Alisa, I think, please, if you can just fire 1 minute quickly, give us your question and introduce yourself, where you're coming from.
My name is Anita, and my question is, I'm from Ghana, and I'm offering public health information. My question is, at which point in the research do you add a little bit of deception in order to get your data, or there's no instance where you can add deception in order to collect your data? Thank you.
So your research is supposed to be based on integrity and honesty. So there is no point where deception is recommended for you to introduce in gathering your data. You have to be transparent. That is when your research is actually credible, it's reliable, and it's also valid. Because those things are very essential in doing a research, because it means the data you gathered is based on deception. Like, these people do not really know what you are doing, and they might not give you the right information because they don't actually understand or have the knowledge of what is required. So it means your result is not really justifying your aims and objectives. It's not going to truly answer your research question. So deception is never recommended at any point. So just find a means to communicate what you are doing. It has to be simple. It does not have to be complex. You want to research on impact of exercise on blood pressure. Do you mind participating in this research? Let them know what. It's just simple terms. You don't have to be very manipulative, because it means the result you get does not answer your research question.
Yes, absolutely. You don't have to expect a particular response. I feel like people do research, say, oh, you must get a yes. It's a yes, it's a no.
No.
Your research finding, whether it's positive or negative, right? In your own mind might be negative, right? Because most time we attempt research with the mindset that, okay, I want to find that this is positive. But that is not the value of research. Research is actually finding something different from what is known. That's what makes your research stand out. So if everybody's saying a ball is pink and you do the research and say this ball is blue, even if you are the only person that sees that ball as blue and you can prove it with research and data, that's what makes your research valuable. Vincent, Alisa, quickly, anyone?
But I also want to add on that, sorry, as a researcher, whatever an idea you have about a particular subject already does not matter. You have to be open-minded, receive new results. That is why you are conducting the research. So even if your result is not falling in line to what you think is going to be, it's fine. It is research. That is the essence of research. Getting to know is not based on your conceived idea or your personal view.
Thank you so much. I am Alisa Innocent from Malawi. I'm doing biomedical sciences at Mzuzu University. My question is on sampling size estimate. Let's say you're doing a research of which your sample size estimate is giving you 300 plus participants. Let's say you will be screening patients with prostate cancer. You went to the hospital and then you did not have an access to reach out to such sampling, like 300 plus patients. You got maybe 100 plus. How do you solve that? Like, does it not affect your results? Thank you.
So you mean if the clinic is unable to provide you with if you're unable to get access to 300 patients in the clinic?
Yes.
So in that case, so you provide the results based on what you get, based on what you have access to, because that's what you have access to. So your the way you are going to present it is going to be a bit different to the way you are going to present it in 300 participants, because it's an estimate. So it's going to be the proportion to the number of participants you are able to get, because you could not get access to 300 patients. You could only get access to 100 patients.
All right. Thank you.
Okay, I am Vincent Ihonga, a medical science student from Malawi. My question goes back to sampling. Since you have indicated that we have got two sampling techniques, probability and the non-probability sampling. So you have talked of stratified sampling and the cluster sampling. Yeah, so I am unable to differentiate these two since they are all involving putting people into groups. So I just want you, if you can come back and explain better on how best can we differentiate these sampling techniques.
Let me go back to the slides. The stratified and the, okay. So for the stratified, based on the example I provided, I illustrated with, so you divide them into group and sample from each. For example, you can divide them based on the north region, the south region, east and west. There are pharmacies that are registered in that particular site, and then you pick randomly from this region. But for the cluster, you randomly pick either entire groups or cluster. Select all pharmacies from 5 randomly chosen states. This one is not based on region now. This one could be on states. So you instead of picking randomly, you've already grouped them. Let's say we have like 5 states and then 100 pharmacists. We have 20 pharmacists in each 5 states. So instead of you to pick from every state, you just select the states at random and pick all the pharmacies that are in that state. Do you get?
Yes, I get it. Hello.
Does that
Yeah,
answer your question?
Hello? Yeah, I'm saying I'm getting it. I'm able to follow.
Okay, so do you get it? Did I answer your question?
Yes, 100%.
Okay, perfect.
Okay,
Next
thank
person,
you.
Thank
please.
you.
Please, the other people, I think after Esther, please, if you can drop your Fatima and drop your question in the chat box, please. Thank you. Esther, please go ahead. Sorry, Esther, are you okay? Okay, we lost you, Esther. Bienvenue, please go ahead. I hope I pronounced your name right. Please help me pronounce it. Tell us. Esther, we lost you. Okay.
Thank you very much. My name is Bienvenu Concorde from Rwanda. I'm a student in Nursing University of Rwanda. And I just wanted to ask a question, if you are getting me.
Yes, we can.
Yeah, thank you very much. So I wanted to ask a question. First one is, if possible, can you tell us about data collection tool validation? And the second one is, I think it is possible that you adopt someone's questionnaire or other data collection tools that have been used in a certain study. So what are the procedures that are followed if you want to adopt, for example, a questionnaire or other data collection tool that have been used in a certain study? Thank you very much.
Yeah. So maybe before Anu comes, there's going to be a separate session on data analysis, and that's where we're going to go a deep dive into like the data tools. But if Anu, if you have thoughts, you can. Yeah.
Yeah, thank you very much.
So as a researcher, we advise, I think you've had a section on literature review and all. So you could check on studies that similar studies to yours, the kind of, sorry, I'm being distracted with this. Okay, so you could check on similar studies to yours that have done it before you. You could check the type of survey instrument that they use. If it's questionnaire, you could also develop your questionnaire based on that. And also your supervisor will also be able to guide you on the right survey instrument, because we are working with diverse things, so it depends on the peculiar situation. So first, check other studies that have been done and see from what they've done, how they go about it. Yours could be different, but you'll be able to see this kind of study. This is the type of thing they use or they've been using over the time. Can I change it, or should I use similar methods?
Yeah, thank you very much, Anu. I think that's very important. Reading, like I said, read research papers, like the authors of those papers that, you are doing like a similar work to. You can actually reach out to them and just ask them for guidance, right? Esther, are you back? Do you want to still ask your question? Please go ahead quickly. We're about to wrap up.
Right. So I want to ask if there is something like seeking ethics retrospectively or seeking a way. I read it somewhere, and I want to ask, like, I guess when we did an outreach was done, and what he did was to like create awareness. And in the course of that outreach, you decided to like assess people's knowledge. So questions was asked to like assess what they know about the subject matter before the enlightenment was done. And let's say later on, a form of program reports is to be done on such outreach. So like, does something like that require an ethic approval? So that's my question. And I also want to know if there's something like seeking a waiver or seeking ethic retrospective.
Okay. Was it a group of patients or was it community? I lost you when you first started. I could not really get exactly what you said.
A community outreach.
Okay, so introducing a new system to them.
It's an awareness outreach. So like information is received from that says they are knowledge. So for such data, is it possible to like go ahead with that without getting an approval, since it was an awareness outreach?
Awareness outreach. Okay, but
Yeah.
they have to know that their information was going to be used. So they could sign a participant consent form to you. They could provide you with a consent form because it's an awareness outreach. But aside the awareness, you want to use the data you generate, and it depends on the type of data that you generate from there. And also, are you going to be including their names in the data analysis? Like who and who is going to handle the data analysis? Anybody can know anybody from anywhere. And whatever information they share with you, is confidential. So you have to decide if you are going to anonymize their names and also let them be aware that you are using their information for research. Do you get? Because you could say they are not learned, but any one of them could be learned, and then they will see the information somewhere one day and they'll come for you. So it's better to be plain. You may not have to apply for ethics officially somewhere, but I think once you are doing an health awareness, I think there are community leaders. Because I could remember when we were doing outreach, you have to take permission from, I think, the community leaders about maybe you want to do an outreach or not, so that they will approve it. So that's like a form of approval first. But the patient themselves, after you've created the awareness and you are using their data with the information they provide, let them know that you are going to use their information for research. It's the best.
All right,
to do. It's the right thing to do, actually.
Because imagine it's you and somebody puts your data out there, right? For example, like because healthcare data are very sensitive. So if you are doing a research for a stigmatized condition like HPV or HIV/AIDS, right? You don't want your data out there that, oh, this person has HIV/AIDS, and tomorrow the person can sue you, right? Take you to the court. So to protect yourself, it's always good to ask, right? If the person says no, you move away. Persons give you consent, make sure it's written and signed so that you can have evidence for yourself. Yeah, sometimes you might have to go back. I remember during my undergrad, I had to go back and do another ethics and added layer of ethics because I needed to do something different, right? So it's very, very important. Back then, I thought they were stressing me, they were kidding me, but now I've come to realize, particularly within the pharmaceutical space, if you're working in a pharmaceutical company, they do clinical research, clinical trials, clinical studies, and they're injecting drugs into people that it's not yet validated. So they have to be informed consent on those people that, okay, I'm actually giving the permission to inject me with this drug, even though I know that this drug might be deadly or this drug might save my life, just to protect the company and protect your reputation. Yeah, so thank you, Anu. I feel like this was a very, very useful session. The research methodology is it's an underrated topic, right? And you people will come to appreciate it. Maybe not today, maybe not during your current research project, but you will come to appreciate it as you continue to move ahead in your career, that you actually need to take consent, right? Even beyond global health, anything you're doing in the world today, it has to be very informed, consent. So thank you so much, Ma, for taking out the time to join this session. And thank you to everyone who has stayed longer than the time. Well, I hope that this was very useful for you. And thank you, Miss Anu, again, on behalf of HSB. I'm just going to put you on the spotlight. You did a master's in health informatics. There are a lot of students who have applied for this opportunity that are doing their research project on like something similar. So we would probably like to link you up with some of them, even if it's just one session you have with them on Zoom, to just talk with them and look through their research project. We really appreciate that. I am seeing that on the chat, some people are asking to connect with each other. Please, I love that already. It's good to have friends in Malawi, in Ghana, in Uganda. You never know where you meet in Rwanda. So yeah, I love Amino. Thank you for starting that. Probably would, if you guys are interested, we'll create a WhatsApp channel or YouTube group for a LinkedIn group for all of us to just connect beyond this research challenge. We have next week. Next week is our final research week, so please don't miss any of the sessions. I think somebody was asking me on the chat that I mentioned that we're going to have an abstract presentation. So the reason is not going to be a part of the judging criteria, but we want to see those who are following and those who are deserving of the grant. Not everybody here is deserving of the grant, but you have to show that you are interested to actually know. So we actually have a list of people who we know that have everybody has great research, but impact, right? The level of impact of their research topic. So we're going to send you an email. If you don't get it today, you get it tomorrow morning with the with the link for you to download the template. So you don't have to have, some people are asking that I've not started my research, I've not completed it, I'm just in the process. You don't have to have started your research project, right? you just need to tell us your background. So you're going to like what we've been taught, right? Previously, the research topic, doing your abstracts, communication. So the reason is I want to see how you communicate yourself, right, to the global stage, right? The background is like the background of your research topic. You're also going to talk about your objective. Why is this important, right? So it's going to be a one-page presentation. Everybody must stick to that one page. So like our guest yesterday said, concise, your elevator pitch, your lightning speech, right? So in 60 seconds, what can you say about your research? So we're going to send the template to you, download it on PPT, begin to work on it because you have 1 week, right? So throughout next week, work on it. On our final presentation will be next week, Saturday. So that next week, Saturday is the last day of this research challenge. And that's where we're going to have the winners announced. That's where the winners are going to present. Everybody, you don't know whether you're going to be the winner. So if you don't have your abstract presentation on that day, we know that you are not ready. You don't want to win the grant. So if you are called upon as one of the top 5 people who won the grant and you don't have your presentation, you are just telling us that please give it to the next person on the list because we already have a ranking of everybody who applied for it. So please make sure you work on it. We're going to send it out either tonight or tomorrow morning. You get it. You work on it till next week, Saturday. So you don't have to have your answer. So for some people who have started their research, if you have the answer to your findings, you can put it. But for those who don't have their research findings yet, just tell us your hypothesis. What do you think that this will come out with based on your current readings, your research, or your findings, right? Or your understanding of you don't have to have done the research. So just tell us your findings. There's going to be a session on methodology, which we've been taught today. So that's why I'm sending it out. We're waiting for this session. So your methodology, how do I want to go about this research? Blah, 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 blah. In one page, everything's going to be on the page. So please make sure you work on it. I'm very, very excited about this. The reason why we are doing this is to make sure that you're not just learning, but also be able to apply what you are learning for your research project. Yeah, so thank you so much, everyone, for joining. I think we can end today. The recordings will be sent out tonight. Also, so please make sure that you if you want to listen. Thank you, Chinaza. Yeah, the recording will be sent out tonight so that everybody would be able to, listen if you want to go back and listen to it again. All right. Thank you, everyone. Have a great one. So next week, and I think somebody wanted to join the WhatsApp group. Next week, we'll create a WhatsApp group for you if you want to join the WhatsApp group. The reason is we're also trying to build a hub of researchers, young researchers that we can guide. And also, if we have project that we feel like somebody has worked on cancer here and it's very good, we can always link you up with such projects. So thank you for joining. Have a great week. Thank you, Miss Anno, for today's session. Really great. One more thing, on Saturday, there's going to be a mentorship session. So there's going to be a breakout room for everyone. So people who have research in cancer, there's going to be a cancer expert. It's going to be a digital health expert in that breakout rooms based on the forms you have filled. We got your form, and those who said you wanted to be paired will be paired. So thank you, everyone, and have a great weekend. Rest, and we get the session tomorrow. You can listen to it. Thank you, everyone. Have a great weekend. Bye.